Hello, my name's Kath Berry and I'm here with Mel Koppelman, and we're here today to talk about professional recognition. Now, this came up in a recent survey that we did where we asked you as an acupuncturist what was troubling you most, and there was a whole range of responses, but one of the highest things on the list was a desire for acupuncture to be recognised by other medical professions and increase referrals from medical doctors. So I've invited along one of our world-leading experts in being able to talk to doctors and understand research, Mel Koppelman, to address this issue of professional issues. So firstly, welcome, Mel. Thanks for joining us today.
Thank you. Thanks for having me.
And so what's your view on how acupuncturists, or we as a profession, can increase our professional recognition?
Good. It's a really good question and a really, really important question. The specifics depend a little bit on the context. So there's a difference between, I suppose, writing a paper or giving a presentation versus finding yourself at a cocktail party with someone who happens to be a medical professional. But what I wanted to address before, I think a lot of people want to know a bit about specifics of what we can say about research and biochemistry and different things like that. But I would like to actually start a bit before that with sort of, speaking to each acupuncturist, you as an individual, where's your mindset at regarding what we do, and how do you feel about what we do in the context of mainstream medicine? So what I notice a lot in speaking to people or, seeing, on Facebook and different professional threads, I think in some ways we have a little bit of an inferiority complex as a profession, and that in itself, in a way, we're almost losing before we start. So it's this, this need or desire to be accepted, which makes a lot of sense. It's a good thing to want. But if you're either giving a presentation or you're speaking at meeting someone at a cocktail party, and you think to yourself, oh, I really hope they don't think I'm a quack. Oh, I really want them to know how amazing it is what we do. In a way, you're almost starting on the wrong foot. And so, this is, not kind of simple or quick fix, but might be the most important bit, is really completely owning, how amazing our profession is and what you do. When you're in your treatment room, you know the results that you get, and you know how much you help people. So in a way, not needing the approval of mainstream medicine or those colleagues to begin with will make it easier to get. There's a little irony there.
And before we move on, why do you think that is? What do you think it is about a whole group of professionals that have, as you say, when we identified this at Acupuncture Professional last year, it's like a collective inferiority complex. In order to understand how we can start to address that, the mindset of the profession, do you have any clues as to why or how this has evolved?
I think I've been increasingly getting interested in the power of stories and storytelling, and we do this with individual. Each of our patients has a story. We have a story, and there's huge power to it because it really shapes how we see reality. And so I think that we, as a profession, have a really disempowering story that we tell, and it's one that I don't really subscribe to. So I notice it a lot. That there's this big conventional medicine out here, and that we're on the fringes. And I've always felt I've practiced all of my professional life in the UK, and I've just come over to the States. But I've always felt like I was in the best situation. I felt more empowered because I was in a private practice, so I had more time with my patients. I was filling a really needed area that conventional medicine couldn't fulfill. I believe I probably got more job satisfaction than most doctors. So I didn't have this story in my head, but I think the story makes a huge difference. And so just this idea of changing, maybe I'm not kind of giving homework, but like if you wanted to address this, maybe just take some time, take a cup of tea, or and write down what do you think is the situation for you professionally, right? And this is something that you would probably be thinking subconsciously and just assume to be true. And then question everything you write down. Is that true? Is there any evidence to suggest that any bit of that is not true? And when you find evidence to the contrary, you start to dissolve these beliefs. And the point is not to come up with something more accurate, because all of these different stories will be equally accurate. It's about coming up with a story that empowers you, that makes you feel how you want to feel. It's about it being useful.
So what is that story? Tell us this story that we can start using as our mantra in the profession to change this collective mindset.
Gosh, well, one thing I would say, because I like to do storytelling with research because I find it very powerful. People kind of just believe it when you have that evidence. So, one is that I suspect, and this is kind of moving on to a little bit of the second thing I want to talk about knowing your audience, but I think that acupuncturists think that the situation in the West is much worse and much more pessimistic than it really is. I know that of 2 studies in the UK about GPs' attitudes towards acupuncture, and over half would recommend it. Now, I think most people would find that surprising. We're so used to focusing on skeptics and criticism, but most doctors would recommend acupuncture, right? So we don't, need to focus on the kind of minority dissenters unless we're doing it strategically. So that's I think part of the story that people have been telling is this disempowering one, but just noticing that there's a reason that you came into this profession, right? You're not insane, you're not crazy, you're not irrational. You came into this profession because you wanted to learn something that was effective and powerful. That there was a need that probably for most people, I think either you or someone benefited from it. So you're doing something really good. So these are all bits of the story to kind of keep to the forefront. And then, anything else, just make sure you're becoming aware of anything that you think that's holding you back and changing it so that you feel good. Otherwise, it's a bit walking around with a disempowering story. It's like walking around with bags of rocks tied to your feet without even realizing you're doing it and complaining that you're tired. We all do it because that's how we're designed. But it's really, I think that's probably the most important bit. Is that bit.
Well, then moving on, you mentioned knowing your audience. Could you tell us a little bit more about what you mean by that?
Yeah, sure. So then there's this idea of like speaking to medical professionals, and again, I think it's worth pausing. If you're watching this, just pause in your mind and think, what image just came up in my head? Because we're all going to have different images. But some people are going to have kind of big, hairy, scary,
when you said that to me, I had an image of a wall made up of people all standing in white coats. So it was a very visual aspect. The idea of talking to medical professions is like a block wall made up of white coats. So you're absolutely right that does have a very powerful resonance in terms of what we perceive that to be.
Absolutely. And I think my image when I'm not feeling empowered is a bit like that. It's like a really stern, humorless man with a stethoscope who just doesn't crack at all. But when I'm feeling much more empowered, I'm married to a doctor. My mom is a doctor. I'm thinking of like my wife's pre-med friends in medical school going to the bar and just just being human, and just being human, just being individuals. So first, yes, medical professionals, they're people too. So we want to be, aware of that. And then again, in a way, with this conversation, I don't know if some people really wanted to focus on giving a presentation, but I'd almost prefer focusing on the cocktail party scenario because you're off the cuff. And this is like the information that you've embedded, and then giving a presentation, you'll prepare for that. So that's something that hopefully you'll feel more confident doing, and having the vocabulary to do that. But so knowing your audience, well, first, the vast majority of doctors are not researchers. That's a good thing to keep in mind because we have been in a place where we're on the outside of mainstream medicine. We've really done our research. As a profession, we've produced a lot of research, and as conscientious practitioners and individuals wanting to be accepted, we've read a lot of it. So now when we meet a doctor, we're like ready to rattle off. We want to rattle off all these statistics. And someone was asking me about, I don't want to cherry pick the data, and it's like this kind of sense of over preparation for that type of conversation, right? But most doctors are not researchers. They have a very limited amount of time about how much research they could read. Some will read very little because they don't have time and because they don't necessarily need to be a clinician. Others might be more research minded, but but then again, they're going to probably be reading in a specific area, clinical area, or in that area. So do not think if you're speaking to you're not speaking to Google Scholar. You're not speaking to PubMed, right? You're speaking to a clinician who may or may not have an intimate knowledge of research base. So back up a step and try to gauge who you're speaking to and their level of interest. Because the first bit of advice, and first takeaway that I give is that if you are at a cocktail party and someone, you're speaking to someone is a doctor, and they ask what you do, and you say that you're an acupuncturist, look at their level of interest. Not everyone's going to care. Not everyone's going to be interested, and that's not because they're bad people. So if they look at you and you could have said that you were a rodeo clown and get the same level of response, this may be a fulfilling opportunity to get into the evidence. So avoiding those conversations will just go a long way for your self-esteem and just for your energy level for what you do. Don't waste your energy on people. Not everyone cares.
And one of the things I was told, from a marketing perspective, is what do you do? I'm an acupuncturist. They will, a bit like my wall of medical professionals, they will picture, whatever is in their mind. Somebody holding a needle or a whole bunch of needles. So I was always given advice to, if somebody says, "What do you do?" You say, "Oh, I help couples that are having trouble conceiving, and I help them increase their chances of fertility." "Oh, how do you do that?" "Oh, I use acupuncture." So in fact, what you're doing is couch it in terms of the people that you're seeing, perhaps your area of interest. I help people who recover from anxiety and depression after periods of taking too many drugs. That would be the line that I would then say to a doctor. And then how do you do that? I use acupuncture. So I think you're absolutely right in the choosing your audience, but also having perhaps a pre-prepared sentence that you can use to hook somebody into the conversation that doesn't start with "I do acupuncture." "Oh,
cricket."
The cricket. So that's really interesting. So you're knowing the audiences. Firstly, I love your point about doctors just being real people, and also doctors probably that idea that doctors aren't researchers, I think, is incredibly refreshing, because it is something that we take for granted, that we do think that we're talking to the whole medical professional, the whole medical profession when we speak to a doctor. So what else can you advise people around, perhaps about the mechanics of acupuncture? That this is where we fall down, is that the language, or that we were taught now in order to understand a system of medicine doesn't apply, and we are then left in a position of either having to retranslate the terminology of acupuncture to make it digestible. But that's obviously a really big leap for people, because it feels like you're speaking in a foreign language.
Yeah, absolutely. And this is a challenge. I mean, I can only share what I've done or what I do, and it seems to work for me. So whatever you do, make it your own, and you got to believe what you're saying. But when I then describe how acupuncture works, first, there's a lot of people we focus on the fact that we don't know exactly how it works. Whoa, okay, yes, to a certain point, but we know so much more about how it works on the biochemical and mechanical level than a lot of conventional medicine. So personally, I do not feel like I'm being dishonest when I confidently certain things that we know about how it works. And also, kind of on the same lines of knowing your audience, there's different levels of communication that you can have, right? So there's the kind of headline of I help couples who are having fertility issues, or I'm an acupuncturist. Then there's oh, well, this is a little bit how I do it. And then there's a third level where we're people are really interested. And then there's the fourth geeky level, right? So of depth of conversation, where maybe this is, I don't know, maybe now you're writing a paper, giving a presentation, or maybe you've really found a doctor who cares. But on that fourth level, that's where we can get into nuances about what we do and do not know. But on that first and second level, let's, present in the affirmative some things that we can honestly say that we do know. And when I present this as well, I like to make it as visual as possible, because even if you're speaking to someone who's maybe a little bit on the fence, it's very hard for them to get the image out of their head, because it doesn't, because now we're talking about stuff that's concrete. So certain things to mention. So one is that we know that the nervous system is involved. We know that there are very fine nerves that are found at greater concentrations acupuncture points than other points, and that these are communicating directly to the brain and the central nervous system. And also, I have to say, you judge your audience about what type of vocab. I mean, those nerves, for example, are called C3 and C4 afferents. Now, I have a feeling if I said that to a doctor, I'd probably sound like I was trying too hard. So I'd probably I would let them geek it up and then respond. Yeah, nerves, they're just nerves, right? So we know that. And then when we give that mechanical stimulus, so when we put an acupuncture needle in, certain chemical things change as well. So and also I'd say, again, depending on your audience, you're probably not going to be speaking to a skeptic necessarily. Just giving one or two of these is going to be very convincing, because the people don't realize how much we know. So one of the very strong bits of evidence is that when we insert an acupuncture needle, something called adenosine is released. And adenosine is a neurotransmitter. It's a local anti-inflammatory. So I like to mention local anti-inflammatory because it doesn't take any leap of the imagination for a medical professional if you say, when you stick a needle in, local anti-inflammatories are released. Okay, so now you're just giving a rationale for local effects, but they can no longer reasonably discount all of acupuncture. You see what I'm saying? It's like a door in. It's like, I'm not saying anything about qi. I'm not saying anything about zhang fu. I'm saying that when you stick a needle in, local anti-inflammatories are released. So that's one step forward. And then what else? Another thing someone mentioned was, trying to communicate how good we are at helping with quote unquote heart sync patients. So patients where there's this kind of mental, emotional, physical thing going on that's very challenging for conventional medicine to treat. So there I mentioned the HPA axis, the hypothalamus pituitary adrenal axis. And I don't know how much to gauge whether or not I don't think every doctor is going to be familiar with that term, maybe most. HPA axis is the brain and the adrenal glands. The acupuncture research shows that true acupuncture more than fake acupuncture, regulates the system incredibly well. Okay, so something about sticking acupuncture needles in these points regulates the hypothalamus. The hypothalamus regulates our whole endocrine system. So again, there's no, instead of, you can say that we do mind-body medicine, I find that this is a little bit more concrete and less wishy-washy and more backed by evidence. And that should be something that, again, is very, it's very difficult to argue with. You're most likely not going to be speaking with someone who wants to argue with you anyways. But if you explain that, they have a visual image that we have from brain scans that this is happening and that we can measure these effects. And that, again, that should open some big doors to being able to speak cogently about what we do on the biochemical side.
Indeed. And so, having said that, do you have a one or two sentences that you use routinely to just sort of, in a nutshell, to your elevator pitch of Acupuncture Works by?
Oh, actually, that's true. I probably should have one. I think I don't, because I like to judge my audience.
Yeah, that's a fair point. That's a really fair point. So that idea that having these blanket statements doesn't necessarily work in that context.
I think. Yeah, I mean, I think that because I love biochemistry and I'm really interested in it, and I have a tendency, I guess that sort of thing of over preparing and sounding like a total nerd. But the thing is, because I realize that most doctors are not researchers, you don't want to make them feel stupid, So you don't want to come in all guns blazing. So you're trying to explain things on that level. But I think of it in my head in terms of those biochemical terms. So I do a little bit of translating. I think most people will be thinking about it in saying food terms, but that's how I'm thinking about it when I'm with my patient, So, so I would in an elevator pitch, I would include the words mechanical stimulus, nervous system, endocrine system. Another one that I like to mention, which has to do with the HPA axis, but it's that rebalancing of sympathetic and parasympathetic nervous system. So again, those are big words: fight or flight, rest and relax. That's something that people are familiar with. And so the sympathetic nervous system is your fight or flight. It's completely changing all of your physiology due to stress to be able to run away from the lion. Your parasympathetic is there to help you rest, digest, procreate, that sort of thing. In modern times, especially if anyone has symptoms or of any kind or an illness, they'll be activating the sympathetic too much. And if you can explain in a few words, sticking the needles in seems to move that balance back. And we know this because this is another good one. So we know this because of studies using heart rate variability. So that's a good one to have in your back pocket. Again, whoever you're speaking to may or may not be familiar with it, but heart rate variability is an excellent measure of the balance between sympathetic and parasympathetic, and it's also strongly correlated to all-cause mortality in any illness. So it's just a really good index of health, and it's an index that I think fits very well with our own theory. So it's one that if you're not familiar with it, read up on it, or I'm happy to share with you, because it's an index that fits so well with the way we see patients and the way we work with patients that you don't have to feel kind of awkward or fraudulent talking about it. This is sort of part of our medicine.
Indeed, and I guess in that idea of being awkward and fraudulent, that I have come across acupuncturists that sort of think, well, why should we? We have this whole system of healing. Why should we try and massage that or manipulate that to fit in with another system? What do you say to those people? What's your thoughts about that?
It's up to you. You don't have to, suit yourself. You can. And I mean, I say that kind of jokingly. That I'm sure there are excellent acupuncturists out there who do not feel a need to translate what they do into other terms and are very successful, and also probably fall into the category of people who don't feel a strong need for acceptance from other conventional practitioners. That's fantastic. If you do want acceptance, then you need to speak the language of the people you're speaking to. Communication is only as good as what is understood. So if you want to speak to someone who's not familiar with with TCM terminology, then don't use TCM terminology. That's just, I think that's communication 101. And if you want to speak to conventional medical folks who have a certain model of the body, and it's a model that's not incompatible with our model, so I learn it because I find it interesting, and because I'm interested in people, and people have Zhang Fu, and they have acupuncture points, and they have tissues, and they have biochemistry. So that's why I do it. So as I say, if you're going to bother to communicate, to put a point across, then I encourage you to do it in a way that the recipient of information is likely to understand it.
And I guess you've and thank you for taking this interest in biochemistry and obviously the bridge between Western and Eastern medicine, because it's people like you that are going to be responsible for changing the future and the nature of the profession for those that are following behind us. And I guess that's my question for you, is around just where do people go for more information about this? Where, and of course that acupuncture professional members will have access to your teaching in 2017 as part of our functional medicine program. But where do you go for this information? Because where do you go? Where would you guide someone to?
Well, I guess where I would guide our profession in general is towards a model of medicine called functional medicine. So this is also, I did another degree in functional medicine, and the reason why I say that is because I think there's an invisible issue that I kind of discovered after I trained in functional medicine, and it's this: we think that there's this dichotomy, or this sort of differences. We have acupuncture and our models that it's based on, whatever those are, so Zhang Fu and Yin Yang over here, and we have biochemistry over there. Functional medicine is based on a systems biology model, like Chinese medicine is, and is predicated on many of the same philosophies. Okay, so the people who founded functional medicine are medical doctors who were not satisfied with the limitation of their models, and they went and studied Chinese medicine and Ayurveda. So it's compatible, and so it uses biochemistry, but it understands people as biopsychosocial beings with beliefs and desires and habits and an individuality and genetics and all of these things. And what I discovered is that, so I'm learning the language of biochemistry to understand my patients, and that philosophy is so foreign to conventional medicine that I still completely lose them. So the invisible issue I'm referring to is that it's not The problem is not that we talk about, at least in my opinion, it's not that we talk about the Sanjiao and spleen 6, like just seeing people as systems, with maybe one pathology that can generate a number of symptoms, or understanding that people might have not enough vitamin C well before they develop scurvy. These things are completely anathema to many conventional doctors. So understanding that can be helpful. So just, I would say, have patience. It's the language we use does inform how we see the world, but it's not just a language thing. It's a way of understanding thing. And that, once I realized that, it just helped me communicate even on a more basic level with conventional medicine.
And following on from that, then how has that changed your clinical practice? How does that change you as a clinician and your relationship with patients, or your understanding of health and medicine?
Doing functional medicine?
Yeah, the combination that now.
Oh gosh, it's so much fun.
Just sort of thinking in practical terms for people watching today, that idea of saying, okay, let's dapple with into the foray of functional medicine, and of course we'll be doing your introduction course in 2017. So it's then sort of saying, well, how is this going to benefit them clinically? How will this benefit their patients?
Okay, well, one thing I should say off the bat is that I have not studied Chinese herbs yet, so. In terms of practice, I had my external medicine, but I was lacking my internal medicine. So any of you who are watching who are acupuncturists and herbalists understand how hamstringing that is. So I studied functional medicine to add internal medicine. That's part of the reason, anyways, is to add internal medicine to what I'm able to offer. Not that it's not the same as Chinese herbs, but it just adds that bit. But I think what I love about it is that. Well, a couple of things. It allows me to understand my patient in a way that is not, that's going to fit in with what the care that they're already receiving with their doctor. And I love being able to interpret patients. And also, I have to say, kind of bring it back full circle. It's this storytelling thing, right? So when we have patients who have complex chronic illness, which part of the issue is that because of the way conventional medicine sees our patients, they are stuck in a very disempowering story. They have symptoms, they may or may not have diagnoses, and they're trying to get better, and doctors are giving them medications usually that are not helping them, making them worse, or whatever it is. And as far as they're aware, they're not going to get better, they're only going to get worse, and they're just trying to manage. And using functional medicine, which involves lab testing, I'm able to show them in black and white their results and in a much more empowering interpretation. Okay, so and this it really helps change the patient's mind, and also it helps with compliance. So, for example, you could very accurately take someone's pulse and give them fantastic advice about managing their lifestyle, right? So they have, let's say they have some sort of kidney deficiency, and you're on it, sleep and rest and all of these stuff that we know is great, and they're trying their best, But now you kind of do a test, which is really a testing something empirical test, black and white, outside of you, and you're tying your recommendations for sleep and rest and everything to this piece of paper. The compliance it goes up here, so that's very powerful as well. So that's one thing that changes. But I enjoy it. I think because I can think both in terms of Zheng Fu and Yin Yang, and biochemistry is 100% yin yang theory. You cannot learn anything about biochemistry without looking at relative balances and turning into each other, and homeostatic control. It's fantastic. But I think that the two systems mutually inform each other.
And what's wonderful about that, of course, is with this idea of having data that you can refer to increase patient awareness and patient compliance. That's also a fantastic way of measuring your treatment progress. Being able to have it's almost like before and after testing, or before, during, and after, in terms of measuring your clinical outcomes. So I think for any practitioner that's interested in being more involved in, mapping their treatments and mapping their clinical successes, then obviously functional medicine is a fantastic way to go. So, is there anything else you'd like to add, in terms of how, within the context of professional recognition, that we've talked today about mindset, of making sure that practitioners themselves don't feel that there's a sense of rechanging that narrative that we have as a profession. The second one being audience as well, so really picking your audience and being able to target your information. And the third one being your content, really know enough about the story to be able to engage in that conversation. Is there anything else that you can add, or any other questions which came up which you felt like needing answers? And of course, what's really lovely is about today is really just an introduction to you and the way the way you work and your mindset with a view of being able to actually go into this in much more detail in 2017. So it's a fantastic introduction to understanding how to better increase professional recognition.
A great question. I mean, I think I mentioned most of the things that I wanted to. Now that you ask, there was another question that did come up, and I just want to touch on it briefly. And it had to do, I think I referred to it about, I want to be able to speak to medical professionals, but when I'm worried that, I'm cherry picking the data and I'm, looking at giving a fair overview. And this is, perhaps my views on this are pragmatic. Well, actually, I'm a pragmatist. Just do what works, do what's okay. And really, I think we sometimes hold ourselves to a higher standard than conventional medicine or I would say even pharmaceutical practice does. That, reading through drug papers, they come up with much more optimistic interpretations of their results than we would do in an acupuncture paper, even if we got better results. So, unless you are presenting a 45-minute talk on a particular clinical outcome and you're going through all of the research, cherry pick your data. It's okay. Like if a Cochrane review came out like it did and said that acupuncture is effective and efficacious for the prevention of migraines, you don't need to go through every single study and counterpoint that's mentioned, weakness to that. Say that. It's okay. It doesn't, there's no kind of, research police that's going to come and get you. As long as you understand what you're communicating, how you're communicating. I think we need to be more positive in our interpretations because we're not fighting on a fair playing field. So, because conventional medicine is being overly optimistic, and then we're being kind of more, we're trying to be more measured and accurate. We're kind of doing ourselves a little bit of a disservice. So, if in a conversation, be familiar with the key studies. And communicate them. And if you want to get to a deeper conversation, then then you can do that. But yes, to go back to your question in a wrap up sort of way, the most important thing by far is your individual mindset. If you feel disempowered in the current medical landscape as you see it, examine that. You can. I know it's that's where to start. Definitely, as soon as you can dissolve those beliefs that make you feel that way, you won. You did it. Yeah.
Excellent. Well, thank you, Mel Koppelman, for joining us today and taking us through that incredible insight and sharing all your expertise.
I hope you enjoyed this free webinar. Please take a moment to subscribe to our YouTube channel and please share on social media. The world will be a better place when more people know about the benefits of acupuncture.